All right, so in this section we want to talk about elbow pain. Elbow pain can be very debilitating. It can be very frustrating because you may not actually have a good reason as to why you have elbow pain. Traditionally, people will talk about tennis elbow, golfer's elbow, and you may say, well, I have elbow pain and I don't do any of those things. So there's a couple things you need to consider. In the elbow, we have the nerve coming from the neck, from the upper part of the arm, and when it gets to the elbow, it actually splits into two. So now you have two nerves running down the forearm. Those two nerves can be irritated or pinched, if you want, on either side of the elbow. The other thing that goes on at the elbow is any flexion or extension of the wrist. The muscles of the forearm that do this action are anchored on the bones of the elbow. So if you're doing a lot of computer work, a lot of work, repetitive work, working with the mouse, maybe typing, these muscles are working to control your hand and your wrist, and you may not even notice that you're getting injuries there. Certainly trauma, basketball, tennis, different things like that can give you the pain. So when you're looking at your elbow pain, you want to find out, pinpoint with your hand exactly where you're feeling the center of that pain. And you also want to check out the muscles below the elbow. They should not be tender. If they are tender, then you're going to want to treat over the spot of pain, and you're going to want to also treat the muscles. In rarer cases, but in cases we do see in clinical practice, pinched nerve in the shoulder can lead to elbow pain. So if you're treating your elbow and you're not seeing results that you'd like to see, please make an appointment with a healthcare provider so they can check your shoulder, check your neck, and check your wrist. You always want to check above and below. If you're having pain over the inside part or the medial part of your elbow, you're going to put the Genesis Health Light directly over the spot where you're feeling the most pain, and we recommend that you would hold it there for 7 to 10 minutes on high, 10 to 12 minutes on low. The elbow is a very easy structure to get at, so we don't have to hold it as long. Please feel free to make yourself as comfortable as possible. So you could use a pillow under your elbow, you could lie down and do this, but you will treat right on the skin, right over the area of main concern. For treating the lateral part or the outside of the elbow, again, you want to make yourself as comfortable as possible, treating 7 to 10 minutes on high, 10 to 12 minutes on low, again, depending on whether you're sensitive to light or not, treating right over the area of the most pain. And by using the light in an inverted position, it makes the handle much more comfortable. And in this case, we put a pillow under the elbow just to make the positioning better. So however you want to position yourself, sitting or lying is fine. Make yourself comfortable, or take a look again at the Genesis Health Light website to look for stand options. But this is a good positioning for treating that part of the body. In this section, I want to remind you to please don't forget to treat the muscles just below the elbow. These are the flexors and extensor muscles. So if any of those are tender to the touch, use the Genesis Health Light directly over the belly of the muscles, because those muscles anchor on the elbow. They could be giving you elbow pain. But if you also reduce the inflammation in those muscles, it's going to reduce your overall pain level. So in this picture, what we're seeing is we are treating the belly of the muscles so that to remove any pain, and it may also alleviate any wrist pain that you may be experiencing.